For everyone with an interest in NASH or more broadly steatotic liver disease, Surf's Up. Season 4, Episode 45 of the podcast still known as Surfing the NASH Tsunami, not for much longer. Our interview with Tel Aviv Medical Center Head of Gastroenterology and Hepatology, Professor Oren Shibolet, starts now.
Today on Surfing the NASH Tsunami.
We have our own recommendations and instructions from the IDF, from the Army. And this states that if there is an air raid siren, you need to retreat to a protected area. If you're sitting in a clinic with a NASH patient and suddenly there's an air raid siren, you can go out of the room and go to the protected shelter. But if this guy is now under sedation, doing a colonoscopy, it's a much more complex issue. Out of the 1,400, there are about 350 soldiers and security forces members, which means there are more than 1,000-something civilians, non-combatants, not armed, not nothing. Out of them, I think there are about 60 kids, patients, people over the age of 80, women. I mean, the number of women, it's horrendous. You know, we are tough people. I myself was a naval officer as part of our compulsory military service. I listen to the stories on the news and I find myself weeping all the time. People have lost their kids, people have lost their babies, people have lost their...
Do you look differently at people of Palestine? Or do you say these are people, in a sense, captive to a bad situation?
I always thought our Palestinian counterparts want peace and that eventually there will be peace between our two countries. I've acted on that belief. I have to say, my belief is shaken. This was totally unprovoked attack. For me, it's hard to comprehend the amount of hatred that was portrayed in the murdering of kids and women and older people. However, I have compassion and empathy for people who are non-combatants on the other side.
As the number of available topics and respondents in steatotic liver disease explodes, this podcast will devote every other week to interviews on a single facet of science or commercial issues. This week, pricing and forecasting guru Roger Green interviews Tel Aviv Medical Center Head of Gastroenterology and Hepatology Professor Oren Shibolet on the impact of the October 7th Hamas invasion on hepatology and medical care in Israel, on the Surfing the NASH Tsunami podcast.
Hi, this is Roger Green, host of the podcast still known as Surfing the NASH Tsunami. This is the second in our series of interview weeks. I've been under the weather most of the week, so we have only one interview, but it's really special. I had the good fortune to arrange an interview with Professor Oren Shibolet, Head of Gastroenterology and Hepatology at the Tel Aviv Medical Center. We talk about the impact of the Hamas invasion on October 7 and its aftermath on the Israeli people and the practice of medicine in Israel today. Afterwards, we'll have a brief business report, so here's our interview.
So a little background to the audience. If you recall, we did an interview in June with Tatiana Deshko, Head of Health Alliances in Ukraine, to give people a flavor of what it was like to be a health professional in Ukraine at that moment in time. That interview was extremely well received, widely listened to, and a lot of you commented on how appreciative you were to do that. So when the events of October 7 happened, I reached out to our friend and past guest, Shirazel Rasagi, to ask if there was a appropriate health professional who we could bring on and talk a little bit about what that day and subsequent events meant in Israel and for health professionals. She was good enough to put me in touch with Professor Oren Shibolet, who is the head of gastroenterology and hepatology at Tel Aviv Medical Center, and Professor Shibolet was good enough to do this interview today. Professor Shalom, how are you this morning? This afternoon, I guess, in Israel.
Yeah, we just had an air raid siren about 20 minutes ago, so we're still recovering a little bit.
How often does that happen this week?
It depends where you live in Israel. So in Tel Aviv, it happens about 5 times a day that we get air raid sirens and we have to run to protected areas within the institute. If you get caught outside, like I was caught about 4 days ago, you just have to lie next to a concrete wall or next to some shelter, cover your head and wait for about 10 minutes. And usually you hear the interceptors of the Iron Dome above you. It's a pretty scary experience. What can I say?
You just said, actually. So thank you for that. And let me note to people who are listening to this interview that there's a possibility, obviously, that we will be interrupted because of Professor Shibolet hears an air siren. That will be the end of this interview, at least for now, until we get a chance to schedule the rest of it. So under these circumstances, and and the stresses of the medical system this week in Israel. Thank you so much for making time to talk with me today. Just to start, please tell us a little bit about your work, how you came to be interested in gastroenterology and hepatology, what you came to medicine to do, and how you came to the position that you hold today.
I'm 60 years old, and I have two sons. After I finished my army service, I went to med school in Jerusalem, in the Hebrew University, and graduating med school, I went to do internal medicine also in Jerusalem. And my head of department was the famous Danny Rachmilevitz, which is an IBD doctor, and he got me into gastro and hepatology. And when I finished my internal medicine, I went to do a gastroenterology. Then I met Professor Danny Shuval, which is also a very famous hepatologist, and he got me interested in hepatology. And the rest is history. I finished that. I went in 2004, I went to Boston to MGH, where I did my postdoc in molecular biology and toll-like receptor signaling. And coming back to Israel, I went back to Hadassah, but in 2011, I was recruited to Tel Aviv Medical Center as the head of the liver unit. And in 2016, I became the head of the whole gastro complex, which is a pretty large department. We have over 120 people with about 35 doctors, about 30 nurses, a lot of research staff. And I had this very well-organized and sophisticated and very dedicated team. I have my own lab here in liver disease. I do a lot of drug-induced liver injury, fatty liver, together with Shira for the last approximately 15 years, and a lot of cholestatic liver diseases, PSC and PBC. I'm part of the International PSC Study Group. I'm on the editorial board of the EASL Studios, and I've been involved in EASL for a long, long time. So that's that. I'm still an active physician. I have my clinics 3 or 4 times a week. I do procedures. A doctor.
Okay, a doctor and a guy who runs a significant department. All good. So a nuance that people who don't know about Israel might not understand. So if you have 2 sons, are they called up to military right now?
So both of them are in the Navy. My oldest son is actually now on reserve service in the Navy. The younger one, during his medical service, encountered a medical problem. He's not in the reserves anymore. So luckily for me, my younger boy is currently at home. He's studying in the Hebrew University to become a computer engineer, but there are no studies now. And the older one is actually in the northern part of Israel on active reserve duty.
And then just one other point while we were setting this interview is you commented that you had originally been scheduled to be in the southern part of Israel today and that appointment was canceled or changed. But when you go to the southern part right now, is that part of your work as a physician or supporting the health of the people who've been affected there, or what is that?
No, there is, like anywhere in the world, there is a shortage of hepatology doctors, liver doctors, and there is a hospital in the southern part of Israel. It's called Barzilai. It's actually in Ashkelon, about 15 kilometers from the border, actually a little less from the border with the Gaza Strip, and they don't have a liver doctor. So because we have a large liver unit, we actually offered them services, and we've been going there for the last 4 or 5 years. So every Thursday, one of the guys, including me, go down there, and we see liver patients in their clinic, and we just support them. And of course, this has been postponed the last 2 weeks because they are under heavy shelling, and they have all ambulatory services put on hold, and they're only treating emergency cases. They received approximately 800 wounded, and they're more or less overwhelmed with injuries and stuff like that. So gastro and hepatology take a second seat. We don't go there.
One more question before we start on the narrative, which is today in Tel Aviv, are you seeing patients who were affected by the invasion, or is that treatment mostly localized to the south?
My hospital, Tel Aviv Medical Center, got about 250 wounded. We had more than 3,000 wounded. The 2 hospitals that took the biggest burden were Soroka, which is the biggest hospital in the southern part of Israel, in Beersheba. They treated over 1,000 patients. And Barzilai, which I mentioned, which took another 1,000. And the rest were divided among other hospitals in Israel. They were flown here by helicopters. We have, of course, a helipad on the roof. And we got about 200 and something patients, out of which about 50 are still hospitalized. We have approximately 12 critically injured soldiers and civilians that are still hospitalized here in very, very difficult shape. Luckily for us, we weren't needed here in Tel Aviv, but actually because of the lack of physicians in Barzilai, my guys went down there to do 2 ERCPs on 2 critically injured patients that had massive injuries in the bile ducts and in the pancreas. So a nurse and the head of the endoscopy unit went there, treated these 2 guys and came back. But overall here, we personally did not take care of any wounded civilians or soldiers, which most of the injuries are orthopedics or surgical, and we weren't needed. So actually, the hospital is being set up for escalation. And we are moving many of our departments to an underground hospital, an emergency hospital that we have here. So our work now is mostly helping the hospital with giving residents and fellows to the internal medicine wards and to the surgical wards, so they take care of patients that are not going to go down to the emergency hospital. But gastro-wise, we have about 50% reduction in our activity. And we're doing much less endoscopies, colonoscopies, and clinics now than we did before. Although, because of the corona, the pandemic, we are very, very used to doing telemedicine, so we're doing that. And also because of the way my unit is built, it's actually well protected. So we are still doing colonoscopies, endoscopies, ERCPs, etc.
So tell me a little bit about your day on October 7th.
So it was a Saturday, so we were all at home. And actually, the air raid siren woke us up around 6:30, which was, it was a big surprise. And waking up, I wasn't exactly sure what was going on. My partner didn't wake up. I told her, wake up, let's go to the protected area. And she said, no, it must be a mistake. But of course, I turned the television on and we started getting reports that something very, very massive was going on in the southern part of Israel. And then towards 9-ish, or 8:30 or so, it turned out to be, the reports were already pouring from the field that there were horrendous casualties. And of course, we called the hospital. We were put on hold. We have emergency posts. Each one in Israel has an emergency post in the hospital. We were on the emergency post calls, but I wasn't needed in the hospital, so I didn't actually go. All the surgical staff, orthopedic staff, and of course, intensive care unit, the ER, everything came in, but we didn't. And so the first time I went to the hospital was on Sunday, which is a working day for us. But all day long, we were glued to the television with horrendous reports and, the casualty numbers. It was horrible to see because it was starting 100, 200, 300, 400. And the nightmare in the big party in the southern part of Israel was unraveling. And they were saying that there are hundreds of young kids casualties. It was really, really a shocking day for all of us. Sunday, we went to the hospital. And then because I'm senior management, I was involved in multiple meetings about setting of the hospital, what needs to be done, all the protected areas, mapping them out, mapping the people that need to be called to reserve service. So we currently have 5 people that were called off to reserve service and they're not here. And the education system, the schooling, everything stopped. So actually we have problems with mothers that have kids and fathers that are on reserve call. So this interrupted our workflow a little bit, but the unbelievable thing is everybody's volunteering, everybody's pitching in, and we actually do not have currently a shortage of gastro doctors, and we're doing okay.
So your direct work then has not been quite so affected, if I read you right.
Right. So the only thing is people are very, very scared, so they're not coming in. So we have a lot of non-shows. So for instance, on Sunday, the Sundays that I came in, I'm a transplant hepatologist. So Sunday is our transplant recipient clinic, and I usually see about 12 people with liver transplant patients, and on Sunday only 2 came in. And this is a major problem that we've encountered in the past. So everything like that interrupts the usual follow-up of these guys. I mean, some of them are stuck maybe without medications, they can reject, etc. Monday is my regular general liver clinic. Only out of usually about 10, only 2 or 3 came in. So this is something people are scared to travel. So even Israel is very, very small. But even if you live, let's say, 15 minutes from Tel Aviv, and you're thinking to yourself, I'm going to drive into Tel Aviv and suddenly be caught outside during an air raid siren or something like that, then people do not come in. And people are scared generally. They're thinking maybe, things will go on. Maybe there'll be some terrorist attacks in Tel Aviv. So they're not coming in. And we are doing all we can to reach out for them through telemedicine and others in order to give them the right care. So this is what we do on the regular days. We just try to get to our patients and treat them. People who need to come in, we try to convince them to come in, because although what I'm telling you, I guess nobody in the Western world has encountered, maybe, in the Ukraine maybe, but nobody in the United States, Canada, etc., in Western Europe has encountered air raid sirens in their living life. And it's a horrendous feeling, but we try to take care of our patients. And if we have 5 a day, it means that we have long periods that are pretty quiet, and we think that we can give these people good care.
Of the patients that you see right now, What percentage are Jewish versus Arab? And are they all Israeli citizens, or do you see actually Palestinians as well?
The Arab population in Israel is about 20%, and this is not evenly distributed in our clinics because there is more, for instance, diabetes in the Arab population, so there's more fatty liver there. But in Tel Aviv, we see mostly Jewish patients, although in the southern part of Tel Aviv, there are Arab neighborhoods in Jaffa. So we have a mixed population portraying the general population in Israel. I would say we probably see 85 to 90% Jewish and 10% Arab. We do not see a lot of Palestinians in Tel Aviv. So Palestinian patients come to hospitals that are near the Palestinian Authority and in Jerusalem. But we do see the occasional Palestinian here, but not in the last 2 weeks.
Is the distribution of patients different in Barzilai, for example, if you go down to Ashkelon?
In Ashkelon, I guess you see more Arab patients because there are Bedouins in that area in the southern part of Israel that come in, but that would portray the general Israeli population. So it would mean that there are 80% Jewish patients and 20% Arab patients.
Does the system in any way treat patients differently based on their backgrounds, or are all patients treated equally because they're all Israelis, or simply because they're all human beings?
Absolutely no difference in treatment. So the Israeli system, we're all covered by national health insurance. So every citizen of Israel has health insurance and can get the best medical care concerning liver transplantation, liver biopsies, medications, everything. And for us, it's nothing. For me, an Arab Israeli is an Israeli. About a third of the staff here are Arabs, doctors, nurses, etc. And actually, for me, the health system is a pillar of light because these guys have been coming in and they're like brothers to us. There is a lot of fear in the Israeli society now because, the atrocities were so horrendous, and people, sometimes it's hard for them to understand that even among the populations, it doesn't mean that all Arabs are Hamas terrorists. And we have here Arab doctors that take care of Jewish patients and Arab nurses that take care of Jewish persons, and we still hold this bond and this friendship inside the department. But outside the department in Israeli society, there's a lot of fear and there's a lot of suspicions towards the Arab population, unfortunately. But concerning patients, I absolutely see no difference between Arabs and Jewish patients in Israel. And in the past, I have to say, I treated terrorists that were caught and injured, and we needed to treat them, so we treated them. We are bound by our oath, and for us, a patient is a patient.
I think that's an important thing for everyone to keep focus on because, if you don't know, you don't know. So thank you for sharing that. Other than the lightening in patient volume, and changes in some procedures, how has gastroenterology and hepatology been affected in the last 10 days? And then your colleagues who are not in gastroenterology and hepatology, how have their practices and lives changed over the past 10 days?
So everybody who's involved in trauma, orthopedic surgery, also all surgeries, because there were, neck wounds, head wounds, neurosurgery, intensive care units, everything has been affected. So internal medicine and the subspecialties like cardiology and hepatology, etc., endocrinology, were not very much affected. But all the others, they're not overwhelmed, but there's a lot of wounded in the hospital, and these guys actually operate a lot, and the hospital is really being set up for an escalation. So we are trying to discharge all the patients who are not in acute medical need in order to have beds ready for people if there's escalation either in the south with the ground move or in the north with Hezbollah. So that's that. But concerning our needs, the only major issue that we're dealing with is protection from the air raid sirens, because what we need to think about that we have our own recommendations and instructions from the IDF, from the army. And this states that if there is an air raid siren, you need to retreat to a protected area, which is most of the new houses in Israel have a security room, which is built from concrete, has a 45 door, and people go there. If you don't have one of those, which about half of the Israeli population don't because they live in older houses, then you need to go to a sheltered room, which means it doesn't have any windows and it's an inner room within the house, away from windows and away from the outer walls. And here, if you're sitting in a clinic with a NASH patient or with a patient and suddenly there's an air raid siren, you can go out of the room and go to the protected shelter. But if this guy is now under sedation doing a colonoscopy, it's a much more complex issue. Luckily for us, our area is protected, but as a member of the National Council for Gastroenterology and Hepatology, heading the data collection on all the other institutes, and many of them do not have a sheltered area and the rooms are exposed. So for instance, if there's a procedure room which is on the outer wall and they have to do a procedure there and suddenly there's an air raid siren, it's an issue. But we're trying to solve that and see how we can do better and keep our patients safe.
So when you say it's an issue, what exactly does that entail?
So for instance, let's say you're in the middle of a colonoscopy and there's an air raid siren. Supposedly, you need to stop the procedure and take the patient to a protected area. If you have the protected area close by, then it's fine. If it's farther down the corridor or something, or if you're in the middle of a procedure like, polypectomy or whatever, then what do you do? So currently, we are trying to set up the procedures only in protected room, etc., which would also affect our volume of our ability to give care.
So right now, what you do is you do whatever, but the goal over time is to minimize situations where patients or physicians or surgeons are exposed to that, or the other staff are exposed to that kind of risk.
Right, exactly.
This is a speculative question, but certainly the world is still feeling the effects of how care was altered by COVID in terms of life expectancies, in terms of certain kinds of diseases that weren't treated that have long-term sequelae. Has anyone started to estimate yet? I'm sure think about yes, but estimate what the impact of this might be on your population in terms of deferred care?
So for us as liver doctors, one of the main issues, of course, is surveillance for hepatoma in cirrhotic patients. And we thought that during COVID because people did not go to have their ultrasounds. And we think that it will be the same here because people, first of all, some of the primary care was interrupted because in the primary care in Israel, there's a lot of young physicians that had to go to the reserve. A lot of the clinics were closed. So people in the primary care do not get the best treatment now. So for instance, if I have a patient who's, 6 months down the line from the last time he saw me with cirrhosis, and I want to do an HCC surveillance on him with ultrasound, and now he's not going to go to do the ultrasound, it might be deferred by 3 or 4 months, and then, down the line, he might have a hepatoma. So that's a major, major concern for us. All kinds of stuff like that. If you need to do a gastroscopy for varices in people with cirrhosis, that's a major concern because these guys will supposedly come with bleeding, etc. So we are concerned about that, and we looked at the data coming from the COVID. We saw there was a decline in treatment of HCV, there was a decline in treatment of HCC, etc. So these serious progressive diseases are badly affected by the lack of ability to go to do screening and surveillance procedures. And we're concerned about that. And tomorrow we have a meeting of the National Council, and I'm sure we will be talking about that and see what we need to do, because we have seen an upsurge of HCC cases in cirrhotic patients after COVID, because people didn't go to do their surveillance visits for almost 2 years.
So I think as I'm listening to you and as I'm assimilating what you're saying, your volume is down significantly, maybe 70-80%, because people is that roughly the range where you said maybe
no,
you'd see 50
I would
and
say 50. Yeah, 50 would be closer to the truth.
It's a huge number. 50 is a huge number. I mean, you don't have to actually 25 would be a huge number, right? In terms of care delayed and care denied. So what I hear you saying, if I understand correctly, is if I have a 10 to 15 minute drive to get to the hospital, I have to ask myself, is it worth going to the hospital to take the risk that on the way there or the way back there will be an air raid siren and I will be completely exposed?
Right, exactly. People talk to me about that all the time. They come in and they're scared, saying, they're planning the things. And I have to tell you, myself, when I go home, I live not far from the hospital, so I walk home and I know all the shelters along the way, because I'm saying to myself, okay, I'm crossing this junction, and what happens if I'm caught in the middle, which is an open space, and I have to run down the street, and I know where all the walls are where I can take shelter. For me, it's work. I see it as my duty to give care to the patients, and I also think that, it's very, very important for us to give continued care, because when something so horrendous happens and people, in a sense, they lose a little bit of faith in the system and they think maybe the system is not working. So this is why I was very, very adamant to all my guys here. And I said, we're not canceling clinics and we're not canceling procedures, because we have to give the feeling to the people that the medical system works as usual. And if you call, because for me, I would say, as a citizen, if I call in a hospital and I say, I need a colonoscopy, is it still going on? They say to me, no, it's not going on. It transmits a sense of panic. So we have tried to be there for the population, but we are scared.
So in general, you say we are scared. What is the level of panic right now in the population?
Panic is not a good word, but, there's concern. There's concern. So in the past, maybe people would be very calm about the air raid sirens, which every now and then, even when we don't have such a huge clash with Gaza, sometimes we do get air raid sirens over the years, and people were very calm about them. But now you see people are very, very obedient to all these instructions. So if I go home and there's an air raid siren, I see all the traffic stops, people evacuate their cars, and they lie next to the cars on the road with their heads covered because they are aware that this one is serious. But I don't think, people are panicky. There's a strong feeling of togetherness. There's a strong feeling of resilience. So for the time being, the population is standing strong. When you lose so many people, now the death toll stands on 1,400. Unfortunately, the population that was there was mostly young. So there's a lot of kids and there's a lot of teenagers and people in their young 20s. For instance, the party that was going on, it was called the Supernova Party, which is a huge event. There were 5,000 people there. And I would say the average age is 20 to 25, and you see pictures from that party of beautiful, beautiful, beautiful men and women dancing and being absolutely happy and being, immersed in the music and everything. And the terrorists came over, surrounded them, and killed hundreds. And when you see these beautiful faces in the pictures of the deceased, it gives you strength because people are angry. People are feeling that the deaths must be revenged in a sense. So the feeling within the population is strong.
So the deaths must be revenged is where the rest of the world can't quite figure out what to make of all this. I want to get a couple of numbers in context to make sure I've got that right. So if in a country of 9 million, 10 million people, there were 9 million, there were 5,000 at the party, and you roll that up by a factor of maybe 35, which would be the U.S. population, against 9, you get to 330, 340, so that's 35 times. So that would be the equivalent roughly of having a festival that had, 180,000 people at it, if you're going to compare it in terms of U.S.
I don't know how many people were at Woodstock or how many people go to Burning Man in the desert there, but there are thousands of people.
A lot less than that. Look, the worst mass casualty in the U.S. was in Las Vegas, where one guy started shooting out of a high-rise at folks at a Jay Sarandon concert. I think there were probably 30,000 people at the concert who were exposed to space, if I remember the numbers correctly, and I could be wrong. So this is a huge swath of the population, number one. And number two is if you have 1,400 casualties to date, that would be the equivalent of 45,000, 50,000 people in the States against a population of 330 million, if I'm doing the math right in my head.
So I'm not doing the math, but it's a huge... So, for instance, in the Yom Kippur War, which was... It was a three-week war. The total number of casualty was about 2,400. So that in a single day, we had 1,400 dead, which is about 2/3 of that death toll at the time. And during the Yom Kippur War, which was in 1973, most of the casualties, 99% of them were soldiers. And here, out of the 1,400, there are about 350 soldiers and security forces members, which means there are more than 1,000-something civilians, non-combatants, not armed, not nothing. Out of them, I think there are about 60 kids, patients, people over the age of 80, women. The number of women, it's horrendous. It's horrendous. We are tough people. I myself was a naval officer as part of our compulsory military service, and I listen to the stories on the news, and I find myself weeping all the time. People have lost their kids. People have lost their babies. People have lost it's horrendous. It's horrendous.
So as a society, how do you look at the people of Palestine, not Hamas? Okay, take Hamas out of this a minute. But do you look differently at the people of Palestine? Or do you say these are people, whatever they feel about Israel, these are also people who are, in a sense, captive to a bad government, a bad situation? How do you deal with that?
So I place myself on the political map of Israel in a side that was always pro-peace. And I always thought that our Palestinian counterparts want peace and that eventually there will be peace between our two countries. And I've acted on that belief. And over the last 9 months of the new government, we don't want this to be political, but I was on the protest side, we will call it that. And I have to say a little bit that my belief is shaken, because this was totally unprovoked attack. And for me, it's hard to comprehend the amount of hatred that was portrayed in the murdering of kids and women and older people. However, I have compassion and empathy for people who are non-combatants on the other side, and there are a lot of people dead or dying in Gaza, and I feel for them because I think that not all are bad. And I think that young people that are being killed in Gaza, they're innocent victims of this horrendous war. But I don't think that Americans or Europeans or Canadians or whomever would be willing to leave. It's like, you live right next to a snake pit, and you're lying there and you're sitting there and you're saying to yourself, I'm not going to treat this snake pit. And, if they bite me, then it's fine. It's okay. This attack was monstrous. And you're saying, what is the solution now? The solution is to say, okay, it happened and do nothing, or do something. And I guess the general feeling in Israel now is that it cannot continue like that. We cannot have somebody who's committed these atrocities against our innocent population continue being on the same level. So I'm not saying that we need to punish, we need to avenge. This is not my feeling. But I think this situation needs to be solved somehow, because otherwise, if you're a resident of a kibbutz next to the Gaza Strip border and you live 800 meters or a kilometer from the fence, the fence was breached and hundreds of people were killed. So what do you say to yourself? How am I going to go back there with my kids if the threat has not been removed? So the threat has to be removed. I do not know how. I'm not a politician. I'm a doctor and I take care of people. But the threat has to be removed, whether through demilitarization in the end, through some other means, but it needs to be removed, because no people will be willing to live there if the threat is still there.
That makes perfect sense, obviously. Why would anybody choose to live in a situation like that? I guess one other question that people outside of Israel might not understand and worth shedding a light on, that the people who lived there, was living there seen as a political statement and seen as an a right-wing statement, or was living there simply a choice people made for a variety of reasons?
Absolutely not. Actually, as a matter of fact, these kibbutzim that are along the border were left-winged. So these towns, these rural agricultural settlements, actually were built in the early days of Israel, in the 50s and the late 40s, and they are all agricultural. It was a very patriotic thing to do at the time. And over the years, and after the 6 Days War, etc., they became just peaceful rural populations, mostly based on agriculture. And generally speaking, kibbutzim in Israel are left-winged, and the towns around the Gaza Strip, Sderot, Netivot, were more right-winged in a sense. But it wasn't a political statement. It's not such a division, and it wasn't a statement in any way. People just lived there because of quality of life, because they wanted to live on agriculture, because they wanted to live close to nature. And over the last years, the last 20 years or so since the separation, it's become a very, very difficult place to live in, because we have several rounds against Hamas, and the bombing and shelling has been going on for the last 15, 20 years or so. And also there are little things, so-called, that we, people in the West do not hear. And for instance, during summer, these are wheat areas. So what they do is they send from Gaza balloons with torches, which fall inside the wheat fields and burn them. So if you're a wheat farmer in the southern part of Israel, you're dealing with constant danger to your livelihood and what you do.
Okay. Is there anything else that you would like people who listen to this podcast, and that would be mostly medical professionals or commercial people, but from in any given month we'll have listeners in 35, 40 countries around the world. Is there anything else you would like to say to them, or you'd like for them to understand about what it is to be in Israel this week, this month?
So let's say, we've had a horrendous week for us. I guess physicians, generally speaking, are willing to give from themselves for the benefit of mankind. And we're willing to treat whomever who is sick. And in liver diseases or other, this is what we want to do. And this has been a horrendous week for us because, first of all, some of our belief in human kindness has been shattered. And you see young people, kids, women, elderly people massacred for nothing just because they were Jewish. So that is, a lot of people use the term, my heart was broken, my beliefs were broken, etc. And it's true. I think we will recover. And I think we are strong and we'll be okay. A major issue for the Israeli medical system is how long this is going to be, because there are other things that we have to take into account. For instance, if this is going to take now 3-4 months of fighting in the north, in the south, etc. So all the medical problems that we raised are going to be strengthened and increased. So it's going to be much, much worse. And the second thing is that a lot of things around it, for instance, clinical trials. My unit, for instance, is a big clinical trial center, and we treat a lot of patients within the PBC, PSC, and other diseases, IBD clinical trials. And I'm thinking to myself, a company that wants to bring in a new medication for IBD or for NASH, why would it bring it to Israel if the situation here is unstable? So I'm thinking about repercussions that might go beyond the direct treating of patients. What would happen to funding that we would need? What would happen to donations that we need, etc., etc. And of course, we're all concerned about a personal safety and the safety of the ones who we love. And, I have an elderly mom. She lives by herself, not far from here, about 20 minutes from here. She has to run from her room to the protected shelter. And I'm saying to myself, she doesn't have to be injured by a bomb. She can fall on the way and break her hip, etc. And I'm thinking about my son who's currently in the reserve service. And, you're worried. And a lot of people are thinking, what will be the future? And this was an earthquake in terms of that. But we are strong. We will keep taking care of patients in Israel, liver and others. And I hope and believe that the Arab Israelis are our friends. They're Israelis, and they will keep on doing the right thing. They will keep on giving treatment to patients, etc. And I think they're part of the Israeli society. So this is very important for me to say, because I believe that and this has always been my belief, that, this is something that will make us strong in the end. So that's that.
So thank you so much for your time today. This is a challenging conversation and a tough topic. And frankly, if you don't live in touch with Israelis every day, it's very, very hard to understand what underlies the feelings and the challenges for the society. So I hope lots of people get to listen to this and to hear your perspective. And I hope to see you, if not before then, maybe to meet in person next year in Milan at EASL, maybe at an earlier event. And thanks again for your time today.
So currently there's a traveling ban because we are all in our emergency posts. So I was hoping to come to the ASLD, but we'll see about that. And if not, hopefully next year in EASL, because this will pass.
If you can make it to Boston, please let me know, because I would love to have a cup of coffee with you there. Okay?
Excellent.
Thank you, sir.
Take care.
Now.
Bye-bye.
And now for the Season 4, Episode 45 Business Report.
Slava Ukraini, Karim Slava, glory to Ukraine, glory to heroes. 2 weeks ago, I ventured slightly into the political to contrast the U.S. Congress, where the House of Representatives had just become speakerless, to the courage of the Ukrainians and a clear decline in confidence in Russia. We posted that episode on Friday, October 6th. The next day, Israelis woke to air raid sirens and the horror of mass slaughter, and the world changed. In today's interview, Oren Shibolet speaks clearly and powerfully of the impact of the invasion, its aftermath on the morale of the Israeli people, and also on the Israeli medical system. Because Professor Shibolet is head of Gastro and Hep at one of Israel's most prominent medical centers, this is a liver episode, but only kind of. Let us all keep in our hearts the over 1,400 souls lost in the massacre, the 200 to 300 hostages taken by Hamas, and also the innocent residents of Gaza, many of whom will suffer and many of whom will die, living under a government that uses civilians as shields. And because we all have hearts big enough to walk and chew gum at the same time, let's keep the Ukrainians in our hearts and our memories as well. Slava Ukraini.
We did not cover UEG in Copenhagen, but it sounds like it was a fantastic event.
So first, kudos to our colleague Jörn Schattenberg, who presented the Maestro and NASH results at the UEG conference in Copenhagen. Many of our other past guests and friends presented major work on NITs and other drugs in development. In general, it's exciting to see non-hepatology conferences paying increasing amounts of attention to steatotic liver disease. That's a trend I expect will grow over time and one from which we will all benefit.
You may have received an email about our Industry Partners program already.
You may already have gotten one or two emails from me about our Industry Partners program. We are looking to build a stable financial program for this podcast by creating low-level base partnerships with 4 to 6 drug and diagnostic companies. I'm sending 10 letters a week and following up personally. If you want to learn more, please let me know. In any case, keep your eyes open. You will probably get something from me in the next couple of weeks.
This week's vault belongs to Tatiana Deshko.
It seemed that nothing would be more appropriate this week than to repost our interview on the health crises associated with the Russian invasion of Ukraine. If listening to Professor Shibolet makes you want to remember the situation in Ukraine, wait until the weekend when we post our vault, because Tatiana Deshko's interview will be part of it. Okay, that's it for the week. I want to thank our team, Jorn, Louise, Jake, Mike, Eric, Steve, for everything they do all the time, and our upcoming transition. I want to thank Oren Shibolet for an exceptionally candid interview, and our good friend Shira Zelbarsagi, who introduced us to Professor Shibolet and helped arrange the interview. Next week, we'll be back to discuss the liver risk score with 2 of its authors, Louise and Jorn. Should be fantastic. Until then, stay safe, surf on. We'll see you on podcast. Bye-bye now.
Have any questions for the surfers? You can send them to surfingnash.com, and we will answer on the podcast or the website.